To continue this video of extraoral and intraoral, we're going to commence with the intraoral portion. We've done the extraoral. So to do the intraoral, the first thing is I'm going to put on my mask. I'm then going to use some hand sanitizer, and then I'm going to put on my gloves. And I'm going to tell the client that I'm going to recline your chair, okay, Diora? And I'm going to open the kit in front of the client so that the client sees that it is a sterile kit and ready to go. Always open the kit in front of the client. And we are going to begin the intraoral examination. I'd like to show everybody that this is an appropriate mirror. This is a double-sided mirror, and it's very helpful for doing intraoral assessments. So we have everything ready to go. We have our indicator strip that shows us that this kit is well sterilized and we're ready to go. So Diora, I'm going to put the chair back.
Okay.
So how are you today?
I'm great, thanks.
Good.
How are you?
I'm great, and we're going to be showing everybody in the audience today how to do a proper intraoral examination. Okay, so the first thing when we do an intraoral examination is we look at the lips, and we pull back the cheeks and roll and check all the lips. And it's also very good to feel around, make sure there's no lumps and bumps. So everything appears to be nice and healthy. This is a beautiful, healthy gingiva, no inflammation. This is what we'd like to see. Okay, so we've done all the extraoral and we've palpated around, and there doesn't appear to be any lumps, bumps, or problems. So now we're going to look at the cheeks. Now, the cheeks, here are the cheeks, and there's just one little cheek biting lesion that we see, but otherwise it's quite healthy and nice. And we're going to tease the salivary glands. So the way to do this, the easiest way, is to take a Q-tip and to go like that, and you can see that the saliva does come out. She does not have xerostomia because when I touch the cheek with the mirror, it does not stick. That is the way to tell whether or not you have xerostomia. And then we are going to tease the submandibular and sublingual gland. The next thing that we're going to do is palpate all around the floor of the mouth. So I'm using bimanual. This here is bidigital, 2 fingers here, all around, and there doesn't appear to be any lumps or bumps here. The next thing I do is I take a 2x2 gauze, stick your tongue out, and I roll that tongue. This is the most important thing, is to roll that tongue and really give a good look. Sometimes you might want to put your mirror in as well. This is the most common area for oral cancer, is the lateral borders of the tongue. And we do the other side. And then don't forget to look on the ventral surface where you now ask the client to say, ah. There you do, and you look and you see a very nice uvula, and the tongue is in good condition. Now the next area is the palatal area. And the palatal area, do not slide your finger. If you slide your finger, you will gag the client. Just place and move it around. So if you do that, place and move, not to slide. If you slide, you will cause gagging, and I do not feel anything abnormal. So, one more time. Some people do it with 2 fingers and 2 hands, like this, or you can do it this way. It is better, preferably, to do it with 2 hands, because then you can see and feel if there's anything wrong. So we have finished our extraoral and our intraoral assessment. Thank you, Diora. You've been a wonderful client. And I want to thank my assistants in the background, behind the scenes, we have Nicole, we have Margarita, and we have Matthew. My sincere appreciations to the dental hygiene students. Thank you.